That is where you can ask us questions. All of our Q&As and webinars this year are accessible on computers, tablets, and smartphones, so you can even take us on the go. When you click on the resources icon, you'll find documents and other information that we'll mention during today's discussion. We'll also ask you to respond to some poll questions, which you'll see appear in the slides window. And at the conclusion of tonight's Q&A, please take a few minutes to complete our survey. It will automatically appear on your screen. Let's get started.
Hello, and welcome to Paying for Your Loved One's Care, Part 1. My name is Tricia Sandiego, and I'm a Senior Advisor on AARP's Caregiving and Health team. I'm joined by Meg Cabot, National Director of the Caregiver Support Program at the U.S. Department of Veterans Affairs, Joshua Charles, a Certified Financial Planner with Financial 360 LLC, and Susan Razik on the phone, Director of the Division of Training in the Office of Communication at the Centers for Medicare and Medicaid Services. Welcome to our speakers. Thanks for being here. And welcome everyone for tuning in tonight. At AARP, we're here to help you be more prepared for your caregiving experiences. This conversation is part one of a two-part discussion on paying for your loved one's care. Today, we'll discuss how to prepare to care and start the conversation with your loved one about their medical care preferences and the costs. We'll talk about Medicaid, what it does and does not cover, and how and when to apply. Medicare, what it does and does not cover, and how and when to apply. You can ask a question at any time. Just type your question in the Q&A box on your screen. We will answer as many questions on air as possible and will make every effort to acknowledge that your question was received. Additionally, this webinar will be available on demand via the links in the resources folder. There, you will also find a copy of the presentation slides for both webinars, plus links to additional helpful resources. Let's kick things off with a quick poll question. We want to know, are you currently caring for a loved one? Yes or no? Select the answer on the screen that applies to you and click Submit. We also encourage you to share your tips and stories with us about starting a caregiving conversation or navigating Medicare, Medicaid, and any other financial matters with your loved ones. Just click on the chat box on your screen. It's the icon that looks like the bubble. Let's take a look at your poll responses. So let's see, it looks like the majority of you are currently a family caregiver. 59% said yes and 41% said no. So it looks like we have a good mix here. So thank you for answering that question. Let's do another one. To follow up, if you are or will be caring for a loved one, are you the one managing that person's finances? Yes or no? Select the answer on the screen that applies to you and click Submit. Let's see. Take a look here. So it looks like 67% of our participants are in fact managing the finances of their loved ones and 33% are not. So thank you for joining us today. Let's dive right into your questions. Don't forget, you can ask a question at any time and we will address as many on air as possible. So let's see first. What do we have here? We have a question from Layla. Thank you, Layla, for joining. I have no idea where to begin to talk to my parents about how to pay for their medical care. Any advice? I think, Joshua, this might be a good one for you in terms of, starting the conversation.
Yeah, and these are hard conversations to have, Tricia. I would submit or suggest that you just talk. Just start the conversation. I went back with my parents, and when I had to have these conversations, the dialogue was something to the effect of, there will come a time where you're not able to make decisions or speak for yourself. And I would like to start learning those values and those goals for you so that I can better understand how I can advocate for you at some point in the future. So I think just getting the conversations going. I will also offer that it makes sense to get a financial planner involved as early as possible. These are complex conversations, things around healthcare powers of attorney or gathering assets, figuring out to make sure that you have the right allocations or that you have the right liquidity when the time comes. So working with a financial advisor, my preference is, or I'll strongly suggest, look into working with a certified financial planner, which, as we talked about before the show, it's one of the strongest credentials in the planning community. And the easiest way to go about doing that is going to www.letsmakeaplan.org. And then from there you can sort out or filter based on your geographic location.
Sounds like a good start. So Joshua, I heard from you, open communication, being honest, and keep trying to have that conversation early and often in order to be fully prepared.
Absolutely.
We have another question here from Juan. This one's Medicare related, so perhaps Susan, you'll be able to answer this for us. How do I know if Medicare will pay for my aunt's upcoming surgery? I tried to ask her, but it did not go well.
Well, one, what I'd like to say is that generally speaking, Medicare covers medically necessary. I can't say this. Sorry, I'm having a hard time. Medical necessity. If it is a medical necessity, it would be covered by Medicare, depending on how her coverage is from Medicare, whether she has original Medicare or a Medicare Advantage plan. She will still have out-of-pocket costs, and that is something that you may want to speak to the provider about to find out what her out-of-pocket costs would be.
Great. Thank you, Susan. Hopefully that helps answer the question one, and if you're having a difficult conversation, maybe you can keep trying again. Let's go to the next question. We have one here from George. This one looks like it's for Meg. Does the VA offer financial planning resources?
So we do have some financial planning resources. In fact, we just, on the caregiver website, www.caregiver.va.gov, just launched a series of short videos about financial planning from the caregiver perspective. So I would offer to check those out. But there are certain benefits that if you receive those benefits, for example, TSGLI, which is one of our life insurance products, if you receive that after having a traumatic injury, you are eligible for some financial planning assistance. So it's a good thing to look into, especially if you're going to receive a large amount of money from VA after a particular incident.
Okay, great. Thank you so much, Meg. And just to reiterate Joshua's point earlier, you mentioned, having a certified financial planner on board is really helpful. It sounds like they really kind of can quarterback the situation and address sort of all the financial aspects of caregiving.
Absolutely.
I also want to mention AARP has a wonderful resource. It's called Prepare to Care, another good workbook for you all. If you're interested in receiving it, you can get it online at www.aarp.org/prepare-to-care. Don't forget, you can share your thoughts with us. Just click on the chat bubble icon on your screen or type them in the Q&A box. Let's take a look at what you've said so far. Actually, here's another question here. We'll go to Heather. How can I find a financial planner to help? Does anyone help out pro bono? Good question. Joshua, do you want to take that one?
Yeah, sure. So I mentioned earlier that to define a CFP specifically, you can go to letsmakeaplan.org. Alternatively, if you're maybe a little bit more needs-based or you're looking for pro bono work, the foundationforfinancialplanning.org is a great website where you can get access to pro bono work. And when you start thinking, and we had a slide that basically shows information as far as things you need to pull together, from bank accounts to investment statements to insurance. There are so many things that you have to try and filter through, from, and I mentioned this earlier, liquidity to figuring out whether we have the right titling. Are assets going to be locked up if somebody becomes incapacitated? Are they going to flow through to the right people if someone passes away? All the way down to figuring out where we have income sources or expenditures, and maybe pulling all that together for these people that we're trying to help. So again, the foundationforfinancialplanning.org might be a great way to get some of those pro bono services to try and pull this together. We just don't know what we don't know. Mm-hmm. So work with somebody who can help you pull this together and knows the right questions to ask.
Great, thank you. That's very helpful. We have a question from Alma. Alma, thank you for submitting. Do I need a power of attorney in order to pay my brother's medical expenses? Joshua, do you want to take that one?
Most likely, yes, but we always want to plan for the worst case scenario. So the best suggestion is always plan for what could happen and always have those documents in place. There's a couple of ways that you can get access to this, these resources. In the state of Maryland, there's actually a power of attorney that they have on their website, which is a general power of attorney, which basically any vendor is required to take. So if you go to powerofattorney.com, and then I think it's /Maryland, you have access to that. There's also resources where you can go online, and like a LegalZoom or a NoroPress might have less expensive alternatives for a very straightforward or boilerplate document. But I'm always going to offer, again, I go back to saying what I said a minute ago, you don't know what you don't know. Work with an attorney whenever possible, just to make sure that you're getting the document that's best suited for your needs or for your specific individual characteristics.
Great, thank you. So working with professionals, always helpful, financial advisors as well as attorneys, adding to the mix. Okay, on a related note, Susan, here's a question about Medicare. If someone were to access their loved one's Medicare and just ask questions on their behalf, how do they go about getting that kind of authority?
There is an authorization to disclose personal health information, which is Form CMS 10106, and it's available on Medicare.gov. If you look at the Medicare.gov website and you go to the top right-hand corner, there is something that says Forms, Help, and Resources. If you click there, you'll be able to find this form, and it gives the person who is caring for someone else the authority to ask specific questions that may involve personal health information.
Great, thank you so much. And again, that website is www.medicare.gov. Another Medicare-related question here from Robert. What is the difference between Medicare Parts A, B, C, and D? Susan, I think this one's for you. I know with Medicare, it's a bit of an alphabet soup.
It can be an alphabet soup, and the differences are that Part A and Part B together make up what we call original Medicare. Part A is hospital insurance, and that's something that you pay for through the years while you're working through taxes. So most people don't have to pay a premium for Part A. Part B, you do have to pay a premium for, and that's medical insurance. So Part A will cover inpatient hospital stays, skilled nursing facility care, home health care services, and hospice care. Part B covers doctor services, outpatient care, home health care, durable medical equipment like wheelchairs, mental health services, and preventive services. Now, many people are used to getting their health care through an HMO or a PPO, and you can do that with Medicare, and that's what Part C is. We call it Medicare Advantage, and it combines your Part A and your Part B coverage, and it generally covers Part D, which is that last letter, D for drug. So Part D is Medicare prescription drug coverage. Medicare Advantage usually has coverage for all Part A and Part B services. It usually covers Part D, and it very often can also cover other things like vision care or dental care that aren't covered by original Medicare. Part D, the Medicare prescription drug coverage, if you have original Medicare, you can buy a standalone Medicare prescription drug plan. And again, if you have Part C, which is Medicare Advantage, your drug coverage is usually included in that plan.
Thanks, Susan. So just to reiterate, it sounds like Medicare Parts A, B, and D are all sort of part of original Medicare, which is one way to get your Medicare coverage, or you can get Medicare through Medicare Part C, which is Medicare Advantage, which is kind of like the HMO plans that you had discussed.
Correct.
Great. Thank you so much. And on that similar note, a question from Sabrina here. When is Medicare enrollment, and how do you apply?
You apply you can apply on socialsecurity.gov. You can also make an appointment to go to your local Social Security office. Most people do have one in their local area. Enrollment in Medicare depends on your circumstances. When people first age into Medicare, their initial enrollment period starts 3 months before, includes the month of, and ends 3 months after the month of their 65th birthday. Now, if you're still working, you may want to delay getting Part B since you have to pay for it, but you should sign up for Part A because you've already paid for it through the years, and it will give you some extra coverage that might work with your employer coverage. But if you're not working and you decide at 65 that you're going to take Part A and Part B, your initial enrollment period is the best time to enroll. If you miss your initial enrollment period, we also have a general enrollment period where you can enroll each year between January and March, and your coverage would begin in July. If you have Medicare, you can make changes to how you get your Medicare during a special enrollment period, during an open enrollment period, which is from October the 15th through December 7th each year, and your coverage that you would change would begin on January 1st of the following year. And then there are also special enrollment periods that occur because of certain life changes, like losing your insurance might give you a special enrollment period that would give you an extra chance to join. And what's so important about joining on time is if you don't, you may have late enrollment penalties. And that's why we try to tell people to make sure that they enroll on time and they don't have gaps in coverage as well.
Great, thank you. It sounds like it's really important to pay attention to those enrollment periods, and it's critical for your coverage. And Susan, where else can people get answers to their specific Medicare questions?
Well, if they're asking questions about enrollment or their premiums, they would go to Social Security. If they're asking general Medicare questions, they can go to www.medicare.gov. There is a lot of information there. There are a lot of publications that people can download or order. They can also call the call center. We have a call center at 1-800-MEDICARE, which is easy to remember. If you look on the screen, you can see the number and the TTY number as well for people who use TTY. And we also encourage people to contact their local state health insurance assistance program. In some states, it might be called the SHIBA. They have some different names in most states, but most states call it the State Health Insurance Program. And they are grantees who receive federal funds to provide free counseling to people with Medicare. So they can help you decide, how to enroll, when to enroll, what plan might be better for you. And if you're providing help for a family member, you could come with them to a meeting with the SHIP. You can schedule the meeting and go in and just sit there and talk through the circumstances. And in order to find the SHIP in your state, you can go to Medicare.gov, and there's a place where it says, find someone I can talk to, and you choose your state and just look up State Health Insurance Assistance Program.
Great, thank you. It sounds like there's a lot of resources to provide assistance with understanding Medicare. There's a lot of pieces there. Let's continue answering your questions. You can ask a question at any time. We will try to answer as many questions on air as possible. I do want to read a comment that I got here from Sharon, who says, AARP's book called The Other Talk, A Guide to Talking with Your Adult Children About the Rest of Your Life, is a great resource. Thank you so much, Sharon, for plugging that in. We have a question from Jennifer. What healthcare options are available for veterans? It sounds like that's one for Meg.
Sure. There are many different aspects to receiving healthcare through VA, and we find certainly really only about half of the veterans in this country actually receive some kind of healthcare through VA. And we often find that it's later in life when a veteran has a more challenging chronic illness or something like that, that they turn to VA to figure out whether or not they are eligible. And so it can be a really important part of planning for the future to find out whether or not you're eligible for VA health care. So VA has medical centers and offers inpatient surgeries and all kinds of different procedures, as well as all kinds of outpatient clinics, primary care. VA also offers a full range of mental health services, and then also a full range of home and community-based services, and those can be incredibly helpful in a caregiving situation. Skilled nursing coming into the home, a homemaker home health aide to provide assistance with activities of daily living and respite services, equipment, a lot of the same things that Medicare and Medicaid do provide. Some of those are going to be available at no cost to the veteran, and some of those sometimes there's going to be a copay depending on the circumstances of the veteran's eligibility.
Okay, great, thank you. That was really helpful. A question here from Scott. How can we budget for medical costs not covered by Medicare or insurance? Good question. Perhaps Joshua, you want to take that one?
That's a great one. I would say off the top of my head, one of my favorite things to do would probably be use a health savings account. Mm-hmm. If you have the opportunity through your employer, you can put money in a tax-preferred manner, let that money continue to grow. A lot of people put the money in and they use it for current expenses for healthcare. I'm going to offer try and let some of that continue growing in a tax-preferred manner, and then eventually use that for some of those costs and not have the tax implications and get the tax deferral. I think it's a great question.
Great, thanks. And a comment for you, Joshua, if you could please repeat the websites that you mentioned for planning and for finding certified financial planners.
Absolutely. So letsmakeaplan.org would be if you're looking specifically for a certified financial planner, or planning I just had a mental block on the other one. I apologize. We'll circle back in just a second.
Sure, no problem. And also AARP.org/caregiving has some great resources as well. I know we have some information there about financial and legal planning. We'll take another question here. This one is related to Medicaid and Medicare. Susan, a question from Sal, who's asking, what is the difference between Medicare and Medicaid? Good question.
That is a very frequently asked question. Medicare is a national program, so it's the same across the country. The federal government administers the Medicare program, and it's health insurance for people who are 65 or older, people with certain disabilities, or people who are diagnosed with end-stage renal disease. It's the nation's primary payer of inpatient hospital services for the elderly and people who have end-stage renal disease. Now, Medicaid, what we say about Medicaid is if you've seen one Medicaid program, you've seen one Medicaid program. There are federal requirements for Medicaid, and Medicaid is administered by state governments within federal rules. But the states do have the opportunity to have different thresholds, different coverages. The health coverage that is provided for people on Medicaid, it's provided because they meet financial and non-financial requirements. And Medicare, it has nothing to do with what your finances are, what your income is, or what your resources are. And Medicaid also is the nation's primary payer of mental health and long-term care services. And it also covers about 40% of all births and prenatal and postpartum care. So, the difference is that one is totally federal, the other one is federal state, and one is for a certain group of people who meet the requirements of age or disability, and the other is for people who have limited incomes and resources.
And Susan, where do you recommend people should go to if they want to find more information specific about Medicaid?
There is a website called Medicaid.gov, and Medicaid.gov can give you some of the more basic federal information, but it can also lead you to your state website.
Great, thank you. So let's go to more questions. We have one here from Laurel. She's asking, my mother is 92 and wants to move into assisted living, but what if she runs out of money? Perhaps Joshua, do you want to take that question?
I'm actually going to go back to the earlier you can do planning, the better. And the two websites we were looking at were letsmakeaplan.org, if you're looking specifically for a certified financial planner, or the foundationforfinancialplanning.org if you're looking for some pro bono help. Questions, these are the types of questions you want to ask up front. Figure out where we are with our loved one's asset base. What do they have in investable assets? What do they have in liquidity or equity in their house? What do they have in income sources, whether they be fixed or variable? What do we have in pensions or guaranteed income versus those things that can fluctuate over time? And do we have the right investment allocation based on what our goals and objectives are for our parents? If we can kind of get our hands on people a little bit earlier and really put that plan in motion, I think we can save a lot of people who are otherwise maybe in a more compromised situation. But then the second part to that, I think, is if we are in a place where we're starting to deplete assets, some of those conversations that Susan can chat about more along the lines of Medicaid planning might come into play.
Right. That's
Start early.
Start early, and you also don't want to impact your own financial health and security. I know family caregivers often have to spend out of pocket to take care of their loved one, and that sometimes can compromise your financial security, your own financial security for yourself, when you want to make sure that you're not, kind of put in the same position. So,
along those lines, so often long-term care planning, people hear long-term care planning, they think, oh, I have to go out and buy an insurance policy. And that's not necessarily the case. A lot of it is just planning. Do we have the right assets or resources? Are we looking for something that can maybe we can extend the risk to somebody else, or are we okay financially? And then how do we go about doing it? And there are so many different opportunities and products out there that can really help enrich people's lives.
Great.
Just getting that in motion early.
Yeah, and having those sometimes can be hard conversations, but having them early and often. Here's a question related to veterans. What is the process for securing assistance from the VA? My mother was married to a World War II vet who was previously married and died 15 years ago. Meg?
There are many different services available to survivors of veterans, and so I would recommend going to the va.gov website, and there's a search box up in the right-hand corner, and you can type in survivor, and all of the survivor benefits will be listed, and it's a great place to start. We'll ask some questions and some other links to get you to where you need to be in terms of getting that information. And I know we're going to talk a lot more about the veteran space next week as well.
Great. And can you just reiterate the caregiver VA website?
Sure. So there's a caregiver website, it's www.caregiver.va.gov. And that gives a lot of information about the kinds of caregiver support that we offer at VA, as well as some additional resources. We also have a caregiver support line, which is a toll-free number. That's 855-260-3274.
Great, thank you. We'll get to more questions in a moment, but I want to let you know that you can visit aarp.org/learn@50+ and aarp.org/caregiving for more information on how you can care for your loved one. We'll continue to discuss paying for your loved one's care in part 2 of this webinar series, taking place next Tuesday, July 31st from 7 to 7:30 p.m. You can register now by clicking on the link in the resources folder on your screen, or go to aarp.org/learn@50+. In part 2, we'll talk about Veterans Administration benefits, long-term care insurance, out-of-pocket costs, and additional resources available to caregivers and their loved ones. If you have questions about any of these topics, including what we've covered tonight, email onlinelearning@aarp.org and we'll try to answer them on Tuesday. Let's see if we have a couple minutes for maybe 1 or 2 questions. Here's an important question that we got from Elizabeth, who's asking about what do you do if your loved one does not have health care coverage? Joshua, do you want to start?
A lot of questions kind of circle around that. That puts you in a place where you're probably going to either need some state assistance. What do you have for assets? Is it a matter of just not qualifying for it? Do we not have work-sponsored coverage? I need a little bit more information on that one.
Okay, but healthcare coverage is an important part of sort of overall financial security of the loved one, and it's important to kind of secure that. And so I know Susan had mentioned trying to avoid gaps in coverage, so things like enrollment periods and stuff are very critical to pay attention to.
So just a couple of questions to go along with that. Some states have guaranteed issue healthcare programs. If it's part of separation from employment, there might be some kind of COBRA benefits. So again, there a little bit more information to be able to ascertain maybe how to work with that. Get with, at a minimum, the foundationforfinancialplanning.org. Get with somebody who might be able to help you with a better resource.
Right. The other thing I would offer is that many employers will offer assistance to their employees around support around caregiving, and so that might be a great place to start. And certainly even some employers, you're able to have family members be a part of your health care. There are different options for that as well. So it might be a good resource to take a look at.
That's a really good point. Sometimes people don't think about their employers, but they're a really good resource. Mm-hmm. We are almost out of time. Any last tips for our audience? We can start with Meg.
Sure. My tip to the audience would be to make sure that if the person you're caring for or yourself are a veteran, that you really look into whether or not you're eligible for some care. Get yourself registered early. It's part of that early planning. Even if you don't think you're going to use that health care right away, it's something that you might need. I know as soon as my father retired, I made sure that he went and got his physical and is registered at the VA. He doesn't go there very often for health care, but it's there if and when we need it as he continues to age.
That's a good tip. Joshua?
I'm going to offer plan now, start now. When you need the documents, if you don't have them, it's too late. Mm-hmm. So you're in the driver's seat. And I think it's one of the hardest conversations between, our parents raise us and now we're kind of in a place where maybe we're going to become the caregivers. I try to explain, and I think this is the strongest way I can do it. While you're in a place where you get to make those decisions, do it. Get the documents in place so they're going to speak for you when you can't speak for yourself, and include your family and friends or whoever your support system is so that everybody's working in tandem with, again, your goals or your value system, so that you really are living the life that you've always wanted, even when you're not in the driver's seat any longer.
All right, good point. Susan, on the phone, do you have a last tip for our audience?
I think my last tip would be to remember about the State Health Insurance Assistance Program, but also to look at your Department of Aging's website for where you live, because there are often local programs that may be helpful. And one other tip is anyone can go to healthcare.gov and apply for coverage online. They may find that they qualify to get a health plan through the health insurance marketplace, and they may get help paying their premiums based on their income. And it's also a streamlined application so that if you are low income and have low resources, you would automatically have your application move through the system and go to your state so that your state could see whether or not you qualify for anything.
Great.
So it's kind of a one-stop shop.
That's a really good tip. Thank you all. And don't forget, you can visit aarp.org/learn@50+ and aarp.org/caregiving for more information on caring for a loved one. You can access all of the links, including to the on-demand version of both parts of this conversation and content mentioned this evening, by clicking on the resources icon. There you'll find links to interactive videos and other helpful tips and tools to help you stay connected, competitive, and current in your financial planning for your caregiving role. Please take a few minutes to complete our survey. It will automatically appear on your screen in just a moment. We hope to see you here next Tuesday. Thank you to Meg, Joshua, and Susan for joining us, and thank you all for joining us tonight. Have a great evening.
Thank you.
Thanks.